So she goes off to her OBGYN and she says, something's not working right. I don't want to have sex anymore. Sex is terrible. And her OB will say to her, well, how is it when you're on vacation? And she'll say, well, it's actually fine now that you mention it on vacation. And so the doctor will say, well, probably must be in your head. Because if it's on vacation, if you're fine on vacation and you're not good at home, then it's clearly you're just too stressed. But that's not true. We need to figure out how to give the woman a good sex life when she's at home and not when she's in Aruba, because she doesn't live in Aruba, most likely. So what we try to do here is say, like, what are all the factors that are kind of going into your current situation? I cannot tell you how many women have been in my office sobbing because they've been in a therapist's office or doctor's office who say to them, just do it, it'll come back, just do it. When a woman's hormones levels are too low, she can't just do it. If she could just do it, she would be just doing it. So one of our jobs here is to kind of have a very good eye on what's happening. And so what we'll do is sometimes boost the hormone levels or boost the dopamine levels, or if there's underlying depression, get at the underlying depression. And then when we think the time is right, that's when we can start introducing the behavioral things, like let's schedule sex, or let's talk about more romantic encounters, or let's talk about introducing some erotica into the relationship. But one has to do that with a very good eye for kind of what's doable for the woman, because otherwise you end up with a woman who not only feels like she has no sex drive, but then she feels even worse about the fact that she can't do anything about having no sex drive.